In this short video, we will introduce you to the paperwork you need, the cardiac clearance, the payment and insurance preparation, preparing for surgery, what to expect the day of surgery, directions after surgery, and tests that may be performed to check your surgical care. We are glad you dedicated your treatment with us, and we are proud to help you live well. Most patients are required by their insurance companies to fill out certain papers for surgery. This includes an official paper signed by you that gives consent to do the surgery. Additional paperwork may be required, and be sure to ask our staff. Cardiac clearance testing services are here to ensure that you have the best surgical outcome. This cardiac clearance is a review of your past medical history and your medications. Patients who undergo cardiac clearance testings can rest assured that they will have the best possible surgical outcomes because we have taken precautions to ensure optimal recovery. Insurance companies offer various benefits for surgical procedures. Most companies base their fees off the type of surgery, whether it's inpatient or outpatient, and whether you have a copay and deductible. To understand what type of coverage your insurance company offers, please make sure to call them and ask for a benefit review. Most insurance customer service representatives will be able to give you an estimate on how much the procedure will cost. If you are self-paying, please be sure to check with the Demand Centers for a payment option. The day before surgery, we will ask you not to have any food after midnight. It is okay to take your blood pressure or your diabetic medications the morning of the surgery. The medications can only be taken with a small sip of water. Make sure to bathe before surgery and leave your valuables at home. Loose clothing will help ensure that you're able to get into and out of your hospital gown easily. Please arrive on the agreed upon time that we have given you. It is important to be on time because you must be in the preoperative area at least 1 hour before surgery. After surgery, you will be in the recovery room for approximately 1 hour. Please make sure you have someone to drive you home after your surgery. If we ask you, please bring any x-rays with you as well. Now that you're at home, relax, take your medications and recover. Make sure that if you are experiencing any bleeding, a high fever, increased swelling, redness, drainage from your incision, or the inability to urinate, that you contact us right away. Always keep and set up a follow-up appointment after surgery. Don't do too much, eat as you normally would, and keep yourself at rest. Do not lift anything over 40 pounds. If you have a Foley catheter, make sure that you follow up with us and have it removed once your urine is clear. Just to make sure that you are healthy and that all is healing well, we may conduct additional testing. Some might include an x-ray after your breakage of a kidney stone, testosterone and estrogen checked after varicocele surgery, a semen analysis after your vasectomy, or a semen analysis after your vasectomy reversal. Still, others might include a pathology or biopsy report if tissues were removed. You may need a flex cysto after prostate surgery, or incision of a urethral stricture, or if a stent was placed. Other options might be needed, and you will need to discuss that with our staff.
The Y Factor, dedicated to men's urological wellness. Schedule your appointment at mancenters.com.